Good afternoon. We're here with Deputy Humboldt County Health Officer Dr. Josh Ennis. Thank you for being here with us.
Yeah, of course.
So we've heard reports of COVID tests at Redwood Acres having a turnaround time of over a week, and a number of people have waited that long only to be told they need to be retested. Some even claim they were told that their tests may have been lost. Can you talk about why and how this is happening for residents? And is it possible that we don't have an accurate count of positive, negative tests in the county because of this?
Yeah, we have also fielded some complaints about test results being lost, and in the few we've been able to follow up upon, they consistently have been resolved as the person initially being notified it's lost, and then a day or two they get their result and it comes back. Those are for the few tests for which we were able to follow up upon. We followed up with OptumServe in regards to it, and they were unable to give a good explanation for why it is occurring. So we do not have a good answer for why it is occurring. I think it's part of the bigger picture, though, across the state, is demand has gone up for the OptumServe test site. Their lab that they're using is having increasing volumes and getting backlogged, and there have been some growing pains. And so we are continually working with OptumServe to try and improve that process. In regards to how that affects the potential count of positives versus negatives in the county, I can say that in general, for every test that we pick up as positive, there's likely many-fold more cases in actuality across the county. And reasons for that are probably several-fold over. It's because of distances involved, and people aren't going to seek testing for that reason. There are probably people who are very mildly symptomatic or asymptomatic altogether, and so they think it's not required to get tested. And finally, the antibody data we have, based on that, suggests that we're only picking up maybe 1 in 10, 1 in 20 cases. That data, I want to caution you, is subject to bias, but it suggests that there's much more widespread circulation than we're picking up solely with our testing.
What is the average wait time for booking the test to the actual day you go in? Are you seeing an increase in people scheduling a test lately, or has the demand for testing remained relatively the same over the pandemic?
So I'm going to make an assumption here, and that this question is getting at OptumServe and some of the issues that we know are ongoing regarding an inability to get in quickly. More recently, I've heard that it's been upwards of a week or a week and a half, and clearly that's not going to be very useful if people are having to wait that long. And when it's coupled with a longer turnaround time, it makes it a fairly ineffective strategy for trying to limit spread of disease. More recently, there have been some issues with staffing of the site itself, and this has impacted our ability to honor some of the more recent appointments and pushed out the dates that someone could schedule a test for. As a result, we have worked with OptumServe to try and take more responsibility and more ownership over some of the local staffing. And with that, we're going to be much more flexible in the future. And so I expect this to be a more temporary thing that we've worked to fix. But it still does not get around the fact that we are seeing cases really pick up across the country, in the state, and demand for testing is going up. And so some of the things that we experienced 2 months ago, 3 months ago, with supply chains getting tighter and having more issue getting personal protective equipment, staffing for this increased demand, all of those things are starting to be of concern again as we see cases tick up. So I'd say the demand for testing has gone up, and we continue to grow testing at an incredible rate, but it also comes with some challenges with growing that fast.
Are local state parks implementing safety measures to reduce the density of visitors over the 4th of July weekend?
Yeah, so state parks, because they are not a part of our county jurisdiction, are not subject to any plans that we are part of reviewing, and we don't set those guidelines for them. Given that they are a state entity, I fully anticipate that they're following the same state guidelines that we at the county level are aligning with.
Excellent, thank you. Everyone has the responsibility to mitigate the spread of COVID-19, including in the outdoors, but a lot of people are talking about traveling and going to the lake, taking road trips, etc. Should people avoid road trips and stay close to home this holiday weekend?
I know this is such a difficult thing for people right now. We are so tired of this. I am so tired of this and would really love to see it go away. I think there's a big continuum here of what we know is safer and what we know is riskier. On one side of that, you sit in home, you don't leave for much anything, and you know you're going to really drastically cut down on any risk of exposure. And that's what shelter in place was, right? At the other end of the spectrum is you're going to large events that are indoors, potentially with lots of aerosol generating procedures such as loud singing, screaming. Think of a large concert. We know that's an extremely risky scenario. And so as we're going into this 4th of July weekend, we know that people really want to get outside. They want to be together, and it is so difficult. But this now, more than ever, with increased disease circulation throughout the state, is the time we need to exercise more caution. This is really one of the most important times. And so when we talk about staying home versus going out on a road trip, the safest thing to do is try to develop your own little celebration that stays at home. That is the safest thing to do. The more you bring people together, the more opportunity you introduce for having disease circulate around. And so we know that some people are going to leave, and if they're going to do it, you really got to take focus on the activities that place at higher risk and keep practicing the things that reduce that risk. That's hand washing, it's wearing a mask, and keeping your distance from people who are not a part of your normal household.
Thank you. What patterns have you noticed about the virus's spread locally in cases to date? Are there places like home or work, for example, where people are more likely to contract it?
Yeah, our experience locally is very much in line what people are saying across the world, really. This disease travels in clusters. Something like 80% of all cases are in the household. It's people who are in close contact, who share indoor spaces for prolonged periods of time. And that's where the vast majority of transmission occurs within household contacts. Now, all it takes is for one of those people in that household to have contact with someone in a different household, and all of a sudden it's made a jump from an entire household to another entire household. And you can see how that can quickly stack upon itself if one of those people is being less responsible and bringing a lot of people together and doing it in a less safe way. We have seen some examples of people who work in what's considered an essential job, and we have concluded it may have been up to community transmission. We have no way of proving that in any way, but I'd say that is a small minority of all cases that we've seen locally.
Last question. Of cases connected to a contact with a known case, approximately what percentage was the contact in the same household, and what percentage traced back to a social contact with someone outside of the household?
I think I've already spoken to this in the last question. I mean, this virus really travels in clusters within households. It's the vast majority of cases, but all it takes is one person within that household to bring it to the next household. And if there's a delay in identifying that or in people coming forward, we find that we're finding out about these cases almost when it's too late, and then we don't exercise the ability to change that. So I think it's important to encourage people to come forward, and so we can act upon the information quickly, and we can potentially reduce the transmission of the disease.
Excellent. Thank you so much.
Yeah, of course.